HIV is an epidemic that affects millions of individuals worldwide. Prevalence is highest in Africa, specifically in the southernmost part of the continent. However, HIV is prevalent across the globe and does not discriminate against who it affects. Men, women, and children are diagnosed every day. The HIV virus targets the body's immune system, making it difficult for your body to fight off this infection. This is especially dangerous as it compromises its ability to fight off other diseases and some types of cancer. HIV is also a disease that has no cure. Individuals can lead long, healthy lives with the virus, but it will always be present in the body. If left untreated, HIV can eventually lead to AIDS, acquired immunodeficiency syndrome. HIV prevalence worldwide is estimated to affect 37.6 million people. Case distribution is far from equal, as it is highest amongst the most underprivileged and poor communities, dropping life expectancy in these areas by up to 20 years. In Canada, an estimated 62,050 people are living with HIV. Indigenous people account for 14% of new HIV infections, but only 4.9% of the total Canadian population. Alarmingly, 13% of cases are not aware that they've been infected, which is a factor in the rising rate. In the USA, the prevalence of HIV is approximately 1.2 million people. Gay, bisexual, and other men who reported male-to-male sexual contact are the populations most affected by HIV. In 2019, gay and bisexual men accounted for 69% of the 36,801 new HIV diagnoses. As mentioned earlier, Africa has the highest rate of current and new diagnoses of HIV. The majority of cases are concentrated in the southern African regions. 91% of the world's HIV-positive children live in Africa. More than 1 million adults and children die every year from HIV/AIDS in Africa alone. The rates are higher in these regions as access to comprehensive healthcare is limited, as well as resources for those infected. Due to limited testing, many individuals are unaware of their HIV-positive status and spread it to others without any knowledge. Furthermore, there's an insufficient supply of antiretroviral drugs, and healthcare providers in 2010 were only able to treat 5 of the 10 million HIV-positive patients in Africa. The best approach to this disease is prevention. HIV is spread through blood and other bodily fluids. This can occur during a number of activities, including sex and intravenous drug use. The only 100% effective method of prevention of HIV is abstinence. However, if you choose to participate, there are strategies you can make to have safer sex and decrease chance of transmission. The first strategy is to protect yourself during sex. The use of condoms can protect yourself and your partner from transmission of HIV and other STDs. There is a false narrative surrounding HIV transmission that implies that it is only a concern of the LGBTQ+ community. However, 33.4% of all HIV cases in Canada are transmitted through heterosexual sex. Substance use disorder can also increase your risk of getting HIV, as individuals under the influence are more likely to engage in risky sexual behavior. Another strategy to prevent HIV is to avoid intravenous drug use. Again, if you do decide to participate, it is important that you do not share needles and other equipment. The risk of getting HIV is very high if an HIV-positive person shares a needle with someone who is HIV negative. Another preventative measure an individual can take is pre-exposure prophylaxis, or PrEP. When taken as prescribed, PrEP can reduce the risk of getting HIV from sex by 99% and from drug use by 74%. Finally, if you are diagnosed with HIV, it is important that you protect others. HIV medication, called antiretroviral therapy, or ART, can reduce the amount of HIV in the blood, called the viral load. HIV medication can make the viral load very low, enough to be untraceable and allow an individual to lead a relatively normal life. Those diagnosed with HIV have to face many stigmas around the virus. False information is constantly being spread out of fear of transmission, which can also be debilitating on an individual who is trying to come to terms with their diagnosis. Individuals are also discriminated upon on their diagnosis, as they are treated differently than those who are HIV negative. This can lead to feelings of shame or guilt, which keeps people from getting tested and ultimately treated. This is why it is so important to have conversations about the true facts of HIV. This subject should be normalized in society to help those living with it feel supported and educate communities about safe practices. There are also many organizations that individuals can volunteer with to help raise awareness and funds for those who cannot obtain proper healthcare and medication. For those living with HIV, there are many resources globally that are available. Crisis counseling, group therapy, and mental health treatment can be found in the resources below for individuals living in Canada, the US, and Africa. World AIDS Day is on December 1st and is meant to raise awareness about the disease and mourn those who have died from the disease. Support is also available for caregivers and those with a loved one going through HIV. For individuals who are trying to support those living with HIV, it is important to have an open and honest conversation with them. At the same time, listening and offering support can be just as helpful. It is also important to educate yourself about the topic to help raise awareness, but also be informed if your loved one is struggling. Encouraging treatment and medication adherence is also a great way to support individuals and help them get through their diagnosis. Finally, being part of a support network for someone can be very taxing on oneself, so it is important that you take care of yourself as well.